All right. It's super hard for me to actually choose one truth bomb that helped me to uncover what was really happening to me when I was nursing and why I was so miserable and why there was just so much turmoil happening in my life. And so I'm going to focus in on this one particular one because I think it impacts the majority in the biggest ways, and that's moral distress. So I didn't have language around this when I was nursing. I had never been told about moral injury or moral distress. Of course, I took ethics like every other nurse, but I didn't really have a comprehension for what this term meant. And so part of what I'm going to deliver in this workshop is not just content, not just information for you to absorb, although there will be a great deal of that as well, but an introduction to some different ideas and some new language that can help you to have a perspective on what is happening for you and why it might not just be about the staffing or about the lack of resources, although that impacts moral distress. And so when you read definitions of moral distress or moral injury, they often talk about like really ethical decisions that you feel challenged with, and then you do them anyways. And so there's a lot of talk about this in particularly like the MAID program that is newer to healthcare, and of course in like long-term care or end-of-life care. However, what I have come to understand, and the more I have reflected on my own path as a nurse, working in neonatal ICU, working in the community, working with people with complex chronic disease, is that moral injury and moral distress, which there's separate, but they're the same, because the distress happens from having to repeatedly do these things that are challenging our moral code, that are challenging our core values. And the injury comes from that repeated assault, and where we essentially are like injuring our soul because we're sacrificing these parts of ourselves that are really integral to who we are and what we bring to this world and things that we value at our very core. And so when I reflect back on my years as a nurse, I see, these different instances that I was doing something because I was told to, because there was an order to do it that didn't feel right. Or I was dealing with a family and I was having to support them or teach them in ways that I didn't feel aligned with. And we do it because that's what we were taught, that's what we were told. And we're just kind of a part of this machine that keeps chugging along, although the pieces are definitely falling apart. But we do it, we make these choices in healthcare as nurses and other healthcare workers because we're a part of this sort of conditioned machine. And when we face a decision that doesn't feel right for us, that does challenge our ethics, our core values, and we do it anyways, that is at the sacrifice to ourselves, because we really suffer with that in many different ways, emotionally, mentally, spiritually, and eventually physically, because the more we continue to assault ourselves in this way, the more we continue to turn our back on what feels really true and right for us and doing something to the contrary to what is right for us, then the deeper this injury goes. And when we have these deep mental and emotional traumas that we're experiencing, and that's really what they are, they eventually start to show up in our body as physical manifestations, which is generally when people start paying attention. When your body starts giving up on you in many different ways or showing like really obtrusive symptoms, that's when we start to really pay attention to what's going on. We can often suffer with like, feeling burned out or feeling depressed or feeling anxious. We can suffer with those things and kind of turn a blind eye to it and just maybe mask it with a bit of like, oh, this is just a normal part of the job. Everybody feels this to some degree, which is true, but also doesn't make it okay. And so, but when the body starts to respond with these physical representations of this ongoing stress inside of us, then people tend to open their eyes and start paying attention. And so my message to you is that you don't have to wait for that. You don't have to wait for your body to start throwing these big, error codes out at you, these big signals and symptoms that are saying something is really misaligned for us here. We're doing things that are not okay, with who we are, that don't align with what is true and valued for us as an individual. And we don't have to wait for that. We can start paying attention to it now and start taking action now in order to course correct, in order to start making choices that are in alignment with what is right for you. And ultimately, when it comes to moral distress and moral injury, the antidote is courage. It's courage to stand up and say no. It's courage to say, this is not right. I'm challenging what is being presented to me here. It's being willing to walk away. And that's not easy because, of course, that confronts all these other pieces of us, all these other beliefs and fears that are inside of us. And so my intention for this workshop is not, like I said, not just to give you language and content, but is actually to move you through some exercises, some embodiment, somatic exercises that help you to look at those pieces that are getting in your way of taking action towards what is right for you. And I just want to touch a little bit on the word trauma that I kind of just threw in there. And it has some different understandings and definitions. So when I use the word trauma, of course, there is a wide spectrum of how trauma shows up for people in their lives. And when I use the term, I'm not necessarily always talking about those big traumatic incidences that happen for people. Now, as nurses, as healthcare workers, we generally have experienced some of those bigger issues, or we have bared witness to them or cared for patients who have undergone those kinds of big traumas. And we take on an element of that, just being the deep feelers, the empaths that we are. And so trauma, although the event, the situation, what actually happened, of course, it's important. It's not always it's not always what's the right word here, sort of what happened doesn't always correlate with the experience that the individual is having. And so the trauma that I'm referring to is actually just your experience inside of your nervous system of feeling unsafe. And for many of us, this happens every single day, multiple times. Multiple times we walk into situations where we're feeling this distress and we feel unsafe inside of our body. We feel unsafe. Our nervous system detects something that feels unsafe to us. And so although the situation, if we compared it to, some other big trauma that has happened to somebody, a car accident or an assault, if we compare it, we see it as like they're not equal, right? So why am I experiencing trauma when I was not assaulted? I just had, this thing happen, or we don't even know what's happened. But when we start to be able to see these experiences that have happened in our life from the time we're children, when we start to see these experiences over the continuum of our life and how they create a sensation, they create a physiological response in our body that tells us we're not safe, how that is trauma. And we've all experienced it. We've all experienced trauma. And in healthcare, you're exposed to a much higher degree of this trauma. And then we are also not given the space, the time, the resources, the support in order to navigate and process and release these emotional traumas that are taking place inside of us. We are not able to come back to a safe and connected place in our nervous system because it's just not built into the system that we have. It's deal with this critical incident and then move on to the next one, move on to the next patient. This patient's waiting for this family member is waiting for this. Oh, you still have to chart. Oh, you still have to do this. Now you've missed your break and now you're even more distressed because now you're hungry. You haven't been to the bathroom. You missed a call from your kid who needed something from you at home. All of this piles up and it creates a traumatic response in your body. So whether you think you have trauma or not, you most likely do, because even if you haven't experienced some big life-altering, traumatic, chaotic, cataclysmic type of event in your life, you've experienced emotional trauma, and that gets stuck in the body. And so also a part of what I want to do in this workshop, what I'm planning for you, is to introduce some somatic mindfulness where you can actually learn to tune into your body, to listen to what is inside, to the messages that your body has, to the messages of your nervous system, to understand those signals that are coming through for you, to understand what it is that you need, and how to cultivate a feeling of safety in your nervous system so that you can find that balance and harmony and ease and peace that you are seeking in your life, that joy that you're seeking, that we're all seeking in our life. You can find it. I know you can find it, but it is going to take some work. And the key to this work is accessing your body, being able to look at the pieces of your life that are not in alignment, that are creating that moral distress or that sacrifice of your core values. And then looking at the held, stuck energy, the stuck trauma in your body, the emotional energy in your body, and finding ways to release it and to move that. Also navigating some of our mindset, because that also creates a distress in our body. When we couple all of these pieces, and I'm going to throw so much more into this workshop that I can't just share with you in a less than 10-minute video, which is already over 10 minutes. It's going to be transformational. That I can guarantee. If you show up and you're willing to be present without distractions, and you just sit with what is coming through for you, and you engage in the process, and you allow yourself with courage and honesty to take that look at where your life is at and where it is that you want to go, I can promise you that you will experience a massive shift in this really short little 3-hour period of time. That I can guarantee, because I have seen it over and over and over again with many of the clients that I have worked with, and in myself. I know that this work can be very difficult and scary for some people. I get it. I really do get it. I've been there. I still visit there sometimes, but at the same time, I also know that you are worth looking at this. You are worth your courage and your honesty to look at the difficult things, to look at the things that you're afraid of, so that you can make the shifts that are needed, so you can find the release that you are craving, so that you can step into the life that you desire and the life that you deserve. So don't hesitate. Click the button, register, make the space, make the time, call in sick, get a babysitter, do whatever it is that you need to do to make space for this for you. If you're feeling called for it, listen to that call. I can guarantee you that there is something very profound waiting for you. I can't wait to meet you.